Millions of us get treated for migraine headaches, but what happens when your medication is no longer as effective? Well, here to explain is neurologist Dr. Valerie Klats with the Hartford HealthCare Headache Center in Westport. Hi, doctor. First of all, thank you so much for your time today.
Thank you for having me.
Unfortunately, so many people suffer with migraines, so this is really helpful information here today. Tell us, what are some signs that your medication may no longer be working anymore?
Some signs that your medication isn't working as well as it used to can include more frequent headache attacks, longer headache attacks, or the symptoms are stronger than they were before. The pain is more severe, or there are other signs such as the light sensitivity and sound sensitivity is stronger than it used to be.
That might come as a shock to people who, have found that their medication works and then all of a sudden it doesn't. What causes these changes?
It varies on so many things that are going on with a person at the time. Have they been sick recently? Are there higher stress levels? Has their sleep quality worsened? Has there been any other changes in their medications or other medical conditions? So with headache, it's very much a peak and valley, and it's never really a straight line like some people may think.
All right. And is it dangerous, I would guess it is, to take your prescriptions more than what's prescribed more frequently?
So when it comes to rescue medication, which is what people take when they have pain to really make that attack more bearable and faster, if you're using rescue medications more often, more than 2-3 times a week, that can make your headaches worse as well as affect any other parts of your body depending on the medication.
All right. And what do you recommend in general when treatment just seems like it's no longer effective?
So that's a good time to really start writing things down. How often are they happening? What is the change in the pattern from what it used to be? And talk to your doctor.
Any holistic therapies? I know a lot of people would really prefer that sometimes.
Yeah, so there are a lot of non-medical or non-prescription managements to headache, and it really depends on the person and how often their headaches are happening. But there are vitamins and natural supplements that treat headache, as well as behavioral techniques and meditation and mindfulness, and as well as some therapeutic techniques if the pain is really originating from the neck.
All right, and any new treatments available as well?
This is a very interesting time for patients with migraine. The landscape of migraine treatment has changed so much. Just in the last few months, there have been several medications approved for both rescue and preventive treatments. So there are a lot more options for patients with migraine they did not have before.
All right, where can people go for more information? This is great information that you've had for us.
Thank you.
All right, doctor, thank you so much for joining. And, of course, we will link you up to additional information on our website, WTNH.com. We'll be right back.